Now, if your student goes on to be in the medical field, they'll have to learn how to be clean and sanitary, of course.
Alex talked to a doctor who has some information from the Centers of Disease Control.
Did you know that many doctors and nurses are cleaning their hands less than they should? Yet hands are one of the most common transmitters of germs, and not just germs that cause colds, but germs that are becoming resistant to antibiotics. Here with more is Dr. Arjun Srinivasan. Good morning, doctor.
Good morning.
Now let's start out broad. How can we avoid infections if you or a loved one are under medical care?
One of the most important things that we can do as healthcare providers, as doctors and nurses, and also as patients, is to make sure that we have clean hands whenever we're going to the doctor and whenever we're delivering care if we're a healthcare provider. Clean hands are the most important thing that we can do to protect our patients. And as a patient, having clean hands is one of the most important things that we can do to keep ourselves healthy. Clean hands count.
Very well put, doctor. Now, when should doctors and nurses clean their hands?
Healthcare providers, doctors, nurses, respiratory therapists, nutritionists, all of us need to make sure that we have clean hands before we touch our patients and before we do any sort of procedure. We recommend that you always clean your hands right before you're going to examine a patient or do any sort of procedure. And of course, after you're done, we also recommend that you clean your hands again.
Well, it seems like a no-brainer. Now, can you tell us the truth about alcohol-based sanitizers and when you should use soap and water instead?
We really do recommend alcohol-based hand sanitizers as really the first line for making sure that our hands are clean. They are phenomenally effective. There are some common misperceptions that are important to debunk about alcohol-based hand sanitizers. There are people who think that they might be less effective than soap and water, and that's not true. In most instances, for most bacteria, alcohol-based hand sanitizers are more effective than soap and water. People also think that alcohol-based hand sanitizers might breed resistance in bacteria, and that's also untrue. These are agents that don't develop resistance in bacteria, and so they're ones that we can use consistently, and we can use them over time. Soap and water and hand washing does still play a role, though. It's important to remember that if your hands are visibly dirty, or you're about to eat, or if you've just gone to the bathroom, it's important still to clean your hands with soap and water. So they both play a role, but for most healthcare providers, we really recommend alcohol-based hand sanitizers as the first line.
That's good to know. Now, it's probably a good idea to get professional opinions when it comes to health. So what are the right questions to ask your doctor to get well and stay well?
It's so important to ask questions of your healthcare team, your doctors, your nurses, when you're a patient, or if you're a family member of a patient. Asking questions and arming ourselves with information is one of the most important things that we can do to get well and to stay well. And one of the things that we really encourage patients and their family members to ask is, have you cleaned your hands? And I know that's something that can be a little intimidating to do. You know, I'm an infectious disease specialist. I work at CDC. I deal with hand hygiene on a daily basis. And sometimes it's intimidating even for me to ask those questions. And one of the things that I recommend to people is to try to find some less threatening ways to ask that. And sometimes I tell people, I'll sometimes say, hey, I know I'm supposed to ask you to clean your hands, or I'm supposed to ask you if you cleaned your hands. Or you could say, CDC and reminds me or tells me that I'm supposed to ask you if you clean your hands. Find whatever way is comfortable for you, but that's a question that is so important to ask. It's so important to be engaged in your care. As a patient, you're the most important part of your healthcare team.
I agree. It's important to have both sides of the equation. Now, is there a web address we can actually go for more information?
Absolutely. There's lots more information available at www.cdc.gov.
Thank you for your time, doctor.
Thank you.
Now stay where you are. We'll be right back.